And we open this new edition with the all-important issue of healthcare. Last month, Yaoundé became the second city in Cameroon after Douala to benefit from the services of the Clinic Home digital platform. So, what is it? Well, its goal is to facilitate services such as home medical consultations, telemedicine, laboratory examinations, delivery of medication, nursing care, or physiotherapy, all without leaving home, an innovation implemented 4 years ago by Dr Philippe Ohandja. This is a report by Maxime Farrell-Bunya. Take a look.
Online consultation is just a click away. Stéphane, who has been in bed for a few days now, has taken the plunge thanks to the E-Santé Cameroon platform. With a smile, he tells us about his motivations.
The fact that medicine is provided at home, psychologically, is a change because we are always afraid to go to the hospital. Now the fact that someone comes to treat you at home, it's much different.
Alerted by a letter, Dr Philippe, accompanied by a nurse, went to his home. Here, everything starts with the taking of vital parameters before the actual treatment.
While administering the care, I anticipate the possible complications related to the diagnosis that I have made. Depending on the complications envisaged or conceivable, the plan is as follows. If I can safely treat him at home, I do it, as is the case with our patient. Or if I realize that it's not possible to treat him at home, and it's better to transfer the patient to an emergency unit or specialized emergencies, then eHealth has at its disposal means of medical vehicles to transport the patient safely to the hospital.
Like Stéphane, many of these patients are already benefiting from the services of this virtual clinic. It offers online consultations, teleconsultation, and home care, among other things, a life-saving innovation after months of testing in the healthcare sector.
The idea of creating Clinic Home, a virtual hospital, even comes from an observation that has been made in public, private, and denominational hospitals, where we have practiced. It is mainly the waiting times that are increasingly prolonged, whether at the level of emergencies or routine consultations. Mainly for general practitioners, the waiting times continue to grow, yet among these waiting patients, some patients are much more serious than others and could have been treated elsewhere.
If the beginnings were complex in a country where internet access is still low, it must be said that the startup's success today puts a smile on the face of many. If the activity is no longer only virtual but also physical and employs 10 people full-time, nearly 200 others benefit indirectly and part-time. The aim here is to make life easier.
The home treatment that we provide in the virtual hospital Clinic Home at the same rate as in any clinic. We are not going to make financial considerations because medicine is not about that. We do not want to charge anything more than what is charged in hospitals.
Established in Cameroon about 4 years ago, this virtual hospital specializes in treating benign pathologies. More than 5 million people have already visited the E-Santé website.
It's an appreciable concept. We have already seen it elsewhere in more developed countries. We will not hesitate to recommend it to others wherever we can.
While Clinic Home aims to provide all Cameroonian families with a family doctor who will take care of their follow-up checkups at home, the promoter intends to popularize the use of this platform in the long term.
To last 4 years in an activity like this, which is also innovative, you must necessarily have a return on investment. It's not necessarily that we will make these profits right away, but we manage to last because we build customer loyalty. We have more and more new customers and more new insurance companies that trust us, allowing us to have good performance indicators and believe that we will grow.
It's worth noting that the application has already reached nearly 5,000 people in Douala and Yaoundé, a windfall boosting the ardor of the designers who intend to make the service accessible to all. However, access to the internet remains an obstacle, given that the internet penetration rate varies only between 21 and 22% in Cameroon.